We have all become keenly aware of the differences between men and women who have cardiovascular disease. My sense is that the rules change between sexes, and we have to constantly be alert for those differences. Now, however, in JACC Cardiovascular Interventions, there is a report that indicates that in some cases the sexes are sometimes on the same level field. The goal of the study was to investigate sex-based differences in long-term clinical and angiographic outcomes after coronary revascularization with drug-eluting stents. Individual patient data from 3 randomized DES trials, that is the SURTAX, LEADERS, and Resolute All-Comers trials, were pooled. 1/3 were women, and angiographic follow-up was available for about 1,500 patients, a lot. The primary endpoint was the composite of cardiac death and MI at 2 years. Now, there were clearly some important differences between the sexes. At baseline, women as compared with men were older, more frequently had diabetes, obesity, and hypertension, less frequently had smoking habits, previous MI, and previous surgical revascularization, and had a smaller reference diameter of the target vessel as well as lower syntax scores. But after adjustment for baseline differences, women and men had an almost identical risk of cardiac death or MI at 2 years. Similarly, risks of target lesion revascularization, target vessel revascularization, and definite or probable stent thrombosis were also comparable for men and women. The authors put a positive spin on their conclusions. They state that the unrestricted use of drug-eluting stents is associated with similar long-term safety and efficacy among women and men with coronary disease. For me, it seems we have at last a study which shows parity between the sexes in long-term outcome after stenting. One less area in which I have to remember that there might be differences. I'm Peter Block, and this is a CardioSource Heart Minute.